Hi, I'm Dr. Randy Martin. We welcome you to our special presentation about Emory's state-of-the-art cardiac imaging services. Our program will provide a preview of just some of the advanced cardiac imaging technology that we offer, technology that can help you provide your cardiac patients with the best diagnostic and treatment options available. Our cardiac imaging facility includes the Emory Clinic on Clifton Road in the heart of Atlanta and our Midtown Atlanta location, Emory Crawford Long Hospital. We'll also introduce you to some of our team, including world-renowned cardiac imaging subspecialists who are ready to work with you and your team. Our process is designed to facilitate a seamless referral experience, providing efficient turnaround and follow-up back to you and your staff. When you work with Emory's cardiac imaging team, you have access to the whole world of Emory Healthcare. Our extended network of specialists and subspecialists from all fields work together in multidisciplinary teams to provide the best outcomes possible. And we are part of ongoing clinical trials and research with the Emory University School of Medicine that makes the latest innovations and knowledge available to you and your patients. 6 physicians lead the impressive cardiac imaging team, which also includes 7 radiologic technologists, 1 nurse practitioner, and 1 RN.
Our physicians subspecialize in cardiac imaging. It's their area of expertise, and that's our strength. Some of the technology has been around for years but has recently been enhanced, or research has led us to discover new diagnostic applications. Our physicians are not only thoroughly familiar with the latest innovative equipment, they're experts at evaluating the results to provide optimum diagnostic value.
This enhanced technology comes in the form of MRI, PET, CT, echocardiography, and cardiac catheterization. With the availability of this technology, past methods of detecting cardiac problems have become obsolete.
New imaging technologies have greatly improved our ability to diagnose and manage coronary artery disease. Indeed, we are very proud to have one of the few dual-source CT scanners in the country. This is a new type of CT scanner. It images at lower radiation dose. It is faster than other CT scanners, and indeed it doesn't even require beta blockers before the scans are performed. Furthermore, it is not as effective as other scanners are by irregular heart rhythms, as well as the body size of the patient, and we can image heavier patients with better quality. Indeed, the CT scan is so fast that within a few seconds we can get very accurate details of the coronary arteries, knowing precisely whether there are plaques among the coronary arteries and whether the plaques are blocking, causing severe stenosis.
Dr. Raji and the Emory Cardiac Imaging team recommend the use of the dual-source CT on an array of cardiovascular symptoms, from chest pain with stable angina to acute coronary syndromes. Another one of our featured procedures, stress nuclear perfusion imaging, is conducted in conjunction with a protocol we've used for years, a treadmill stress test. Nuclear perfusion imaging measures the blood flow to the patient's heart during exercise or drug-induced heart acceleration. The patient receives a small dose of a radioactive tracer, either thallium or technetium, and a gamma camera is then used to visualize the distribution of blood in the myocardium. For an even more accurate assessment of myocardial perfusion and metabolism, Emory Cardiac Imaging offers cardiac PET CT. Our innovative, integrated equipment combines the best of these imaging technologies. And for assessment of cardiac size and function, as well as valvular function and pericardial disease, our cardiac echocardiography lab at Emory offers the latest technology.
Besides cardiac CT, other imaging modalities have improved our ability to diagnose and manage cardiovascular disease. Among others, cardiac MRI has become one of the most important tools for today's cardiovascular specialist. It is a perfect replacement for echocardiography for patients with poor windows, also for patients that cannot tolerate TEE. But besides that, it provides fantastic images for patients with congenital heart disease, patients with constrictive or restrictive pericarditis, and other conditions such as aortic dissection, myocardial viability, myocardial perfusion, cardiac tumors, and many more.
Today's cardiac imaging services at Emory are moving beyond what we dreamed possible just a few short years ago. For you and for your patients, that means improved diagnosis, improved treatment, and save lives. We hope that you have learned a bit more than you might have known about Emory's latest cardiac imaging capabilities and innovation, and how we partner with you to provide positive outcomes for your patients. We see patients at Emory Clinic Building A and Emory Crawford Long Hospital locations. For more information or to make a referral, call 404-778-SCAN or visit us at emoryhealthcare.org and click on Radiology Services. Thanks for joining us.